making access clear and easy for improved patient care. That's what the Braun Caresite needleless connector delivers. The Braun Caresite Luer Access device is a closed-system needleless connector. With its innovative split septum valve positive displacement design, Caresite helps to reduce patient risk of IV catheter occlusions. Activated by a Luer lock connection, the Caresite Luer Access device is easy to clean and disinfect. Let's explore the uses, features, and benefits that make Caresite the superior choice in clinician safety and clinical performance. This patient has a dual-lumen peripherally inserted central catheter in place, commonly called a PICC, that is being used to administer IV fluids and antibiotics. On the distal end of both PICC lumens is a Caresite Luer Access device. One lumen is connected to the primary IV line that supplies fluids and antibiotics to the patient. The second lumen is not currently being used. The healthcare clinician is at the patient's bedside preparing to flush the unused lumen, a procedure that is part of routine maintenance at this facility. The clinician has already prepared the work area and the necessary supplies. In compliance with best practice procedures, the clinician will follow aseptic technique and has performed proper hand hygiene. She is now donning gloves before accessing the patient's IV line. The clinician continues following best practice by disinfecting the Caresite Luer Access device before access. According to instructions for use or facility protocol, the clinician scrubs the access top of the Caresite vigorously with an alcohol pad or appropriate disinfectant, twisting back and forth in a circular motion. The alcohol must be allowed to dry, and the Caresite access site top must not be touched after it is disinfected. While the alcohol is drying, let's take a closer look at the exterior design. The clear outer housing of the Caresite Luer Access device provides complete visibility of the fluid path, allowing for immediate confirmation of a thorough flushing. The Caresite Luer Guide Access Site top provides a smooth surface that permits easy cleaning, easy connection, and reduces the risk of unintentional touch contamination. The Luer Guide design makes connection easy by guiding the male Luer taper into place with minimal effort for a quick, effortless, and secure connection. This design reduces potential contamination and slippage of the syringe tip during connection. The male Luer lock connector attaches securely to the IV catheter line or extension set. After the clinician has properly disinfected the Caresite Luer Access device, she continues the flushing procedure. Caresite supports both saline-only and heparin flushing options to meet any healthcare facility's protocols. If the IV line is clamped according to facility protocol, the clinician unclamps the line. The Luer lock flush syringe is then attached by inserting it directly into the Caresite Luer Access device, turning the syringe clockwise. This Luer connection opens the Caresite flow path, allowing for aspiration, injection, or infusion. Before continuing with the flush procedure, let's look at the internal design of the Caresite Luer Access device. A view of the inner components and fluid flow tells an important story. Upon connection with a Luer lock syringe or IV tubing, the external seal of Caresite opens. Then, pressure on the internal plunger opens the flow path, so fluid can flow through the split septum and into the device. This design allows the fluid to flow in an open, unrestricted way all around the solid plunger. There are no interstitial spaces or hidden areas where fluid could accumulate and become trapped. The fluid volume retained by Caresite is a mere 0.2 milliliter. When the syringe or IV tubing is disconnected, Caresite automatically closes. The clinician is preparing to disconnect the final flush syringe after completing the flush procedure. She visually confirms that the fluid path has been appropriately cleared and then disconnects the syringe. Clamping the IV line is not necessary with the Caresite Luer access device. However, individual healthcare facility protocols may require IV lines to be clamped when not in use. If the IV line is to be clamped, it should be clamped after disconnecting the syringe to allow the positive displacement to occur. This will help decrease the incidence of catheter occlusions. During this procedure, the clinician continually follows best practice by disinfecting the Caresite Luer Guide access site top with alcohol before attaching each flush solution syringe and after disconnecting the final syringe. The positive displacement feature automatically pushes a small volume of fluid through the catheter when a Luer syringe is disconnected from the Caresite Luer access device. Let's watch that again in slow motion. Positive displacement prevents blood from coming back into the catheter lumen, which may cause occlusions. This is a one-time burst of fluid, 0.03 milliliter, not a continuous pressure. As a result, the catheter contains only flush solution. Positive displacement will also occur when the Luer connector of the IV tubing is disconnected from the Caresite Luer access device. The clinician is now preparing to disconnect a completed secondary antibiotic infusion attached to the primary line through an integrated Caresite Y-site Luer access device. The clinician has again followed best practice and aseptic technique by performing proper hand hygiene and applying clean gloves. The secondary line is disconnected easily by turning the Luer connection counterclockwise. The unique Caresite Y-site design has an integrated fluid path. This design assures that drugs clear the line quickly because it is part of the continuous flow path of the primary line. After disconnecting the secondary administration set, the clinician follows best practice by placing a new sterile dead-end cap on the end of the secondary tubing set. The clinician then disinfects the access top of the Caresite integrated Y-site with alcohol, allows it to dry, and flushes the Y-site according to healthcare facility protocol. Best practice is followed by disinfecting the access top of the Caresite Y-site again. Caresite offers unique features and benefits to both patients and clinicians. The ideal clear housing of the Caresite Luer access device allows for easy inspection of the fluid path and confirmation of proper flushing. The open fluid path around the plunger eliminates interstitial space so that fluid and bacteria cannot become entrapped. The Caresite Luer Guide access top provides a smooth surface, permitting easy cleaning and a design that allows quick, effortless Luer connections, making access easy. The Easy Grip barrel is ergonomically designed to minimize finger slips and touch contamination. Caresite is available in multiple configurations to meet a variety of healthcare setting needs. Using only one design system, the versatile Caresite simplifies practice for clinicians and eliminates confusion in disconnecting and clamping procedures. The Caresite Luer access device high flow rate of 9 to 12 liters per hour and power injector compatible high pressure capacity of 300 psi and 10 milliliters per second increase its utility within healthcare settings. Caresite is free of latex and DEHP. It is lipid resistant and non-hemolytic. Caresite has shown repeatable performance for up to 216 accesses, has no metal components, and can be used in an MRI environment when it is secured out of the direct path of imaging. By design, the Caresite needleless connector helps reduce catheter occlusions by preventing backflow of blood into the IV catheter at final disconnection. Designed by nurses for nurses and their patients, the Braun Caresite Lure Access device. Making access clear and easy for improved patient care.